As Americans hope to get back to normal, the experts say we need more widespread diagnostic testing for this coronavirus. First on CBS This Morning, our senior medical correspondent, that's Dr. Tara Narula, spoke to a top medical advocate who thinks the government could be doing more.
We are still not where we need to be in terms of testing for COVID-19.
That's the warning from Dr. David Skorton, president of the Association of American Medical Colleges. It's echoed in a letter he sent to the White House Coronavirus Task Force this week, calling for more federal involvement in the testing process.
We were not ready for such a big deal as this pandemic has become.
According to the COVID Tracking Project, more than 3.2 million tests have been run in the United States. That's enough for less than 1% of the country, and it falls short of what experts say is needed to reopen America. The American Enterprise Institute estimates 750,000 tests per week are needed. Other groups put that number in the millions. As reported infections continue to rise, many testing sites across the country are being met with long lines. One site in Miami closed after 90 minutes Monday because it already reached capacity.
I was very frustrated. In fact, after I got off the phone with them, I cried.
And Americans say they're still having trouble with testing access. Circe Farrell says she was denied a coronavirus test 5 times as her symptoms got worse, even after her doctor recommended one. Farrell said she was concerned about her mother, who is immunocompromised.
If my mom wakes up and she can't breathe and I've got to rush her to the emergency room, I need to be able to tell them I'm COVID positive.
What has been the biggest rate limiting factor in terms of quickly scaling up testing?
It actually hasn't been one thing, but because there are probably between 20 and 30 very specific things that are needed to report each individual test, there is a slightly different bottleneck in any of those different things that we need.
LabCorp, one of America's largest private labs, says it can perform 55 to 65,000 tests per day. Chief Medical Officer Dr. Brian Cavaney tells CBS This Morning they want to continue increasing that testing capacity if possible.
We have to have every one of those supplies in the right amount so that we can go through our lab specimens and process them as efficiently as possible.
What types of problems do we face if we do not ramp up testing quick enough?
In order to understand the basic substrate that we're dealing with, the basic number of people who have it, whether or not they have symptoms, we have to be ready for extensive testing. But we can't just pretend we're going to go back to business as usual.
Tara, we just can't get this testing right, and it's so critical to the process. So how do we get to the point where we are testing the numbers of people that the experts say that we should be testing in a timely manner?
Well, Gail, everybody says it's one word: leadership. Leadership from the federal government and at a state level, and also combined action with the private sector. We need this test to be ubiquitous, to be efficient, and to have a rapid turnaround time. Without that, experts say we're really flying blind, and it's not just a question of reopening the economy, but really keeping the economy open. So the two issues are building stronger lab platforms, the ability to run the test, the machinery, and also fixing those problems on the supply side. So the issues with the swabs and the reagents. If we can do that both quickly, then hopefully we can successfully reopen the economy and keep it open.
Yep, but as you said, it starts with leadership. Thank you, Tara.